Hey everybody, this is Ohad Pearl here, Geriatric Care Manager for Covered Caregiver. I just came across a very important article put out by Fidelity Investments. It was done about 2 weeks ago. Every year, Fidelity Investments puts out an estimate of what the healthcare costs will be for seniors and more specifically those who will be retiring. And they came out this year saying that a 65-year-old couple will need $300,000 of their retirement funds to fund their health care during that time period. It's quite a big, hefty bill. And it just goes to show you how much investments are important as you're going through life and career and getting closer to retirement. $300,000 for a 65-year-old couple. One of the things that really stood out is that because of the COVID-19 pandemic, many people who were in the workforce have now accelerated their timeline to leave the workforce. And that number is actually 18% within the next 10 years. Within 10 years of retirement, will be leaving sooner than expected, and which means they're going to have to fill in that gap between whenever they retire and the age of 65 when Medicare benefits are eligible for that person. And so that 300,000 in addition to that gap is quite a hefty financial obstacle for families, for people or couples who are nearing retirement to think about as well. The other really important point is in the 20 years prior, in 2002, this $300,000 is actually up by 88%. So there's so much healthcare costs that have gone up in that time, and this is not just adding inflation over year into the dialogue. But it is also designed to reflect the enormous healthcare costs we've been seeing over the last 20 years. So what we do want to mention here and also make a point, although we are providing a lot of information to our elderly and senior clients and community, is that those who are 25 or 30 years away from retirement really need to start thinking about how to invest. And one of those, very instrumental ways is a health savings account, an HSA. You want to speak to your financial planner about that and see what's right for you, because it also, it takes a moment to think about which current health plan will help you with your health savings account when you do choose an HSA account to help for health savings and retirement. And the reason we want to think about that is because consider a couple saving and investing their annual HSA contributions over a 30-year period, taking into account that a future healthcare savings goal will likely be greater than $300,000 over time. First, by maxing out HSA savings opportunities and investing at an average hypothetical 7% annual rate of return, a couple could potentially accumulate $300,000 after approximately 18 years and nearly $1 million after 30 years. So it's important for those who are in the middle of their career and working towards retirement to consider an HSA, because if these are the numbers we're looking at in 2021, 300,000, then I can only imagine 20 years from now we'd probably be at $500,000. And the reason being is that with medical technologies and wonderful discoveries and experimentations, as we did see with the vaccines, which uses mRNA technology, we're going to see a lot of people living quite a bit longer of lives and have much more quality of life. So our medical expenses will definitely increase during that time, since we're living longer and using more medical discoveries and technologies to further that length of time here on this earth, and in addition, giving us quality. So we might be suffering from some certain diagnoses today. However, in 5 to 10 years' time, even after your retirement, we may have found some cures for certain diseases or lessen the burden of what those diseases may do to your life and give you more quality. So we have to take that into consideration, that in the next 20 years, we're going to be looking at a lot more medical expenses as you eye and hone in on those retirement years. And so in conclusion, if you're already retired and in your retirement years and those golden years, and you already know what the cost is and what's been coming out of your pocket to pay those health costs every month on those premiums. And then if you've gone through any diagnoses or certain outcomes, then you've been feeling it. And if you are approaching retirement age, you may have thought or already decided that you're going to be leaving that workforce quite early, and have to start thinking about how you fill that gap between the age you are at now and the age of 65, when Medicare beneficiaries do come into active status for you. Also keep in mind some of the current administrations or further future administrations may move that Medicare age, just like they have said for retirement age, from the age of 65 to 67, maybe even 7 years old. So we have to look out for that as that comes on. Currently it is 65, and so we want to make sure that that gap between, if you're leaving the workforce early, you will be able to fill that, whether it's 2, 5, or 10-year gap when Medicare benefits kick in for you. And of course, if you are in the middle of your career and you've got 20, 25 years, consider it a health savings account. It's a wonderful tax-free account that grows without tax implications until it's pulled out for any current health-related expenses, or if money is maximized and kept in there for an 18-year period. We found that you will clear that $300,000 on a 7% year return, and if it's 30 years, very close to $1 million. So some things for all of you to keep in mind. For our elderly, that's a big chunk of money, and we know you're using it wisely, and hope you are considering some other methods if you don't have those savings. And one of those other methods that, in particular, the state of California deals with is Medi-Cal. A third of the state is actually on Medi-Cal. And usually Medi-Cal is for a disabled person to get on and that they qualify, or someone above the age of 65. So you can only imagine the amount of people who will be coming into the system at the age of 65, into that Medi-Cal system, who will be having to take care of. So there's a huge burden on the state, as well as the Medicaid program that runs through the nation. So if you don't have those savings, and you are a low-income individual, Medi-Cal might be the option for you. However, it is burdened by the state and the amount of people who are on that program. And so hopefully in the coming future, and current administrations and future administrations can budget out accordingly and make sure that healthcare is a priority and that it is being coordinated and organized in a fashion that can assist our elderly as they age. I thank you again. I hope this video shared some knowledge that you may not have known previously, although we did know about healthcare rising over the last decade or so, maybe even more. Putting it actually on a piece of paper by Fidelity Investments, $300,000 during your retirement years is quite a hefty bill, and we want you to be prepared for it. Thank you, and we'll see you in the next one. Take care.